The Second World War brought huge change to Britain. Local and national authorities became far more involved in organising hospitals and medical care. Some people received free medical care to ensure they were fit for their roles in the war. More people became aware of the poverty in which some people lived, due to greater mixing of people in the armed forces. And because of the war effort at home, great social change had been promised to help people after the First World War, but didn't happen. Many people wanted the Second World War to bring about this change so that people's lives would actually improve. In 1941, William Beveridge was tasked by the British government to investigate what measures should be put in place to ensure a better future for everyone. His Beveridge report recommended sweeping changes, including unemployment benefit, pensions, and sick pay, all funded by taxes. Crucially, it highlighted the role ill health and lack of healthcare played in creating poverty, and recommended a national health service where everyone would be entitled to free medical care at the point of access. Beveridge's recommendations struck a chord with the British public. When a Labour government was elected as the war ended in 1945, it set about putting Beveridge's recommendations into practice. July 5, 1948, marked the birth of the National Health Service. Under the NHS, all British citizens were entitled to a wide range of free services, from GP appointments and specialist consultations, to hospital care, surgery, medicines, ambulances, maternity care, and more. The NHS also took on responsibilities for medical research and providing teaching hospitals for doctors and nurses. Access to medical care was improved almost instantly, especially for the poorest in society who had never seen a doctor before because they could not afford to. More people sought medical care earlier, improving their chances of recovery, while healthcare became more equal around the country as doctors were all paid the same depending on qualifications and experience, rather than where they practiced. The health of the nation improved with the advent of the NHS. Life expectancy started to rise and infant mortality dropped drastically. The NHS was funded through tax, but the costs rose rapidly, so later on some services had to be paid for. In essence, the Second World War provided the impetus for a seismic shift in public health in Britain, leading to the establishment of the NHS. The impact of this institution on public health has been profound and transformative, making healthcare accessible to all, regardless of wealth or status. The NHS serves as a testament to the power of social reform and the enduring legacy of William Beveridge's vision.